Thank you, Mr. Chairman. I thank you all for being here. Raised several interesting things. Ms. Greeley, I just learned that in my state, the patient does not own her data. Does HLC have a position on whether or not the patient should own her data?
We think it's important that patients do own their data and that they have access to that data. And that really the providers and those working with that patient health information really are the stewards of that information.
So simple answer, yes, and I thank you for that. Ms. Savage, you raised the point, I think you did, of the ability for the health plan. Again, do I own the data that the health plan has? Or should I own that data?
So as you mentioned, it's really a matter of state law. So technically within a health plan, you may not own the data, but you certainly have a right to get a copy.
So let me ask,
state of the law.
Define the data. If the health plan is purchasing data from data brokers, not just about the doctor who saw me for a busted arm, but rather the data from the grocery store as to whether or not I'm buying high cholesterol food, should I have the right to that data?
You have a right to get any data that the health plan is using to make a medical decision about you.
Now define medical decision.
Well, it's a little bit ambiguous, and so
that's what I thought.
That's right. But I want to definitely distinguish, you don't have a right to get data that's used, for example, to calculate a measure, because that's not a...
calculate a measure?
Like a measure, like a plan's HEDIS measure for how many people referred to a mammogram or something like that.
Got it.
That's not about you. But if they're using that data to decide that you should or should not have a particular treatment, or should not have a premium increase, that is definitely within the data you should be able to get access to.
Now you say should, implying that you personally think that we should, but legally, do I have access to that data?
Absolutely, you legally have access to that. The problem is that in carrying that out, obviously there's a lot of gaps in how people do that. That issue of individuals getting their own data is, I think, a top 5 complaint at OCR.
So do we have a need, therefore, for standardization of how the patient would access her data and what exactly comprises that data so that there is not this variability in response?
I think there are some great paths of standardization beginning to take hold. The idea of using an app and a standard API is one, although not all data will be available behind that API in the immediate future. A second is the Association of Health Information Management, AHIMA, is working on a standardized form, and they're urging people to adopt it voluntarily so that it can be turned into an online form so people can use it, but it's not enough.
I think that my colleagues and I certainly am interested, if y'all have ideas as to how I could know if the health app that I'm using that is feeding up to the insurance plan, that I actually have that data as well as that which they purchase from data brokers, which I'm told is quite extensive.
Right, so that's a couple of different issues, but in my longer testimony, I referred to an article that I did with 10 or so tips people could just adopt right now that would make it easier for patients, and nothing prevents a health insurer from adopting those. I want to separate that for a moment from the broker purchased data, because we don't know exactly which health plans are doing that, and secondly, or thirdly, from the app you choose to use.
I get that.
All
so
different things.
That's my question for you, Dr. Ream. So I recently read of somebody partnering with somebody so that smartwatches were on the wrist of the insured. And I thought to myself, now they know how many steps I'm taking a day and whether or not my gait becomes shuffling. And so maybe I have the first onset of Parkinson's disease, right? And should that be protected, the fact that I am basically telling them that I may be at risk for a neurologic disease. By the way, I don't have a neurologic disease, for the record, that I know of.
So I would characterize that as soon as that personal health data gets transmitted into the healthcare system, that information should be protected. So,
but I don't believe it necessarily currently is, correct?
Well, if that, if let's say you have an EMR that allows you to add personal health devices to that EMR so that the patient who's wearing that watch or scale, for that instance, feeds my EMR, then that information's into the EMR, and it's protected, at least in my practice, as is every other.
Now, you're speaking of the theoretical, but I'm pressing on you. Do we know that is the case?
Only if it enters the EMR. So I would say we don't know that is the case.
So if it goes to the health plan and not to the doc,
right?
But if it goes to the health plan, Is that part of the data that Ms. Savage refers to as being a covered entity, a HIPAA-protected set of data, or not?
I do not know.
I don't know either. Ms. Savage?
Yes, the health plan is a covered entity under HIPAA, just like a physician's
But is the
office.
app, the information that they're receiving from the app, considered part of that covered data?
So when it flows into the covered entity's custody, it becomes covered by HIPAA. The second thing to remember is OCR has been very clear, when the app is sponsored by or paid for by the covered entity, the collection by the app is in fact covered by HIPAA. The one place that OCR doesn't reach is to an app that is not paid for or sponsored by a covered entity itself.
Got it. So if I just voluntarily give, I'm going over. Thank you, Mr. Chair.
Thank you, Senator Cassidy. Senator Murray.